Hi everyone, I did my genetic project on sickle cell anemia, so let's get started. Just as an introduction, sickle cell anemia is an autosomal recessive inherited disorder, which we'll explain more in coming slides, but it is the most common blood inherited disorder. With an estimated 70 to 100,000 Americans diagnosed with it, and even more have the sickle cell trait, which means they're a carrier, but they don't necessarily express the symptoms of sickle cell anemia. Sickle cell anemia is caused by a mutation in the beta globin gene, and there are multiple types of sickle cell disease. Sickle cell anemia is just the most common type that we see. For prevalence, like I said before, about 100,000 people in the U.S. are diagnosed with sickle cell anemia. It's most prevalent in certain races and ethnic groups, African Americans being the most commonly diagnosed. 1 in 12 are carriers, and then 1 in 365 are actually afflicted with the disorder. It's also really prevalent in Hispanic Americans as well. That comes second behind African Americans, but also individuals of Middle Eastern, Asian, Indian, and Mediterranean descent are also more commonly afflicted with it. The molecular causes, as I stated before, sickle cell anemia is caused by a mutation in the HBB gene, which is the beta globin gene. This gene is located on chromosome 11. The reason sickle cell anemia occurs because of a mutation on this gene is because it affects the beta globin structure in hemoglobin. So hemoglobin is made of 4 total subunits. 2 of them are alpha and 2 of them are beta. So when someone has this sickle cell trait or the sickle cell mutation, it affects the structure of the beta globin within the hemoglobin molecule. And this is important because hemoglobin is responsible for the carrying capacity of oxygen molecules. So if anything about hemoglobin is affected, if it's mutated, that affects its ability to transport oxygen, and that causes a systemic issue within the body. Overall, like I said before, the mutation just causes the beta globin molecules within hemoglobin to have a different shape versus their non-mutated counterparts. So as you can see in this picture here, normal red blood cells are disc-shaped. They're like plates almost, and this is most efficient for carrying oxygen molecules. And then you have the characteristic sickle shape, and this occurs because of the mutation in the beta globin molecule that causes it to have a different shape. So just to build on that, as I was saying before, so normally in people who don't have sickle cell anemia, the 2 subunits of the beta globin work in conjunction with the 2 subunits of alpha globin within red blood cells, and this enables the red blood cell molecule to carry oxygen while it's bound to the heme molecule. But in sickle cell anemia, because of that mutation on the HBB gene on chromosome 11, there's a substitution of an amino acid, and this is what causes a structure change. So in normal unmutated red blood cells within that beta globin subunit, the protein that is normally there, the amino acid that is normally there, is glutamic acid. But when you have the mutated gene, the glutamic acid is replaced with valine on position 6 in a normal beta globin. So this is what causes this change in structure and ultimately the change in function of the sickle cell blood cells. So when glutamic acid is replaced by valine in the abnormal hemoglobin molecules, this is what causes that sickle shape. And so the sickle cells, the red blood cells that are not disc-shaped anymore, they're sickle cells, are irregular, they're sticky, they stick together, they get lodged in blood vessels, and they also die prematurely. So this leads to all the systemic symptoms we see in people who have sickle cell anemia, which we'll get into in just a second. So some symptoms that occur more commonly with people who have sickle cell anemia are chronic diffuse muscular pain that sometimes can come in like episodes. So it's not present all the time, every day, 24/7. but they do have pain episodes that become very painful, and that's because of the sickle red blood cells getting lodged in blood vessels and affecting the circulation to certain areas of the body. Also because sickle cells and sickle cell anemia die prematurely, people have anemia, hence the name sickle cell anemia. They're also more prone to infections, swelling, delayed growth, and vision issues, and this is all just building off the circulation issues that come with sickle cell anemia. And even worse or more progressive or more serious issues that come along with sickle cell anemia is increased risk for stroke, acute chest syndrome, and organ tissue failure and or death. So this also occurs because of the impeding of circulation. So like stroke, those sickle cells can get lodged in blood vessels in the brain and cause a stroke. Acute chest syndrome is also pretty much the same thing. The blood flow gets restricted to that area of the body, and organ tissue failure and or death occurs because of restricted circulation. People with sickle cell anemia are also at higher risk for DVT or pulmonary embolisms. This again comes back to how the blood is cut off, or it clots really easily because of sickle cells lodged together. Leg ulcers, hand-foot syndrome, and splenic sequestration. So hand-foot syndrome is when people with sickle cell anemia, their hands and their feet swell, and it can also occur in conjunction with a fever due to the circulation issues. Treatment for people with sickle cell anemia, it really just focuses on the management of symptoms. Currently, there is no cure for sickle cell anemia, but things are being worked on, which I'll touch on in just a second. But the most common treatment is the use of a drug called hydroxyurea. And then NSAIDs, opioid pain medications, can help with just the pain episodes that people will commonly get with sickle cell anemia. And newer drugs are being developed to possibly help prevent the sickling of the red blood cells and hemolysis, which is when the blood cells rupture and die, which leads to the anemia. Currently, things are being researched and worked on in terms of stem cell or bone marrow transplant, which this has the potential to cure sickle cell. And so people with sickle cell anemia do have a reduced life expectancy. Again, it depends on the severity of the symptoms. Some people don't live past early childhood and others live a normal life expectancy. So as I stated before, sickle cell anemia is an autosomal recessive disorder. This means an individual must inherit 2 copies of the mutated gene, one from the mother and one from the father, in order to be afflicted with the disorder. So if only one abnormal, it's called the S gene, is inherited, then the person is a carrier instead of being afflicted with it. So the most common genotype, the only genotype for sickle cell anemia is SS, and that's where they inherit both copies of the S gene. So in these Punnett squares, you can see if both parents are afflicted, their offspring have a 100% chance of being afflicted. If one parent is afflicted and the other has a completely normal genotype, all their children will be carriers for the sickle cell trait. But if one is afflicted and one is a carrier, then 50% chance that their offspring will have the disease, and then 50% that they will be a carrier. So here's just a pedigree that kind of builds more on the autosomal recessive patterns. So you can see Jim up here at the top is afflicted, and he marries someone who is not afflicted. And so their children don't have it. But then you can see down here with Jamie and Rob, they both express sickle cell disease, sickle cell anemia. They both have it, so their child will obviously have it, 100% chance. But Jim's kids, all his kids are carriers. So if a carrier got with someone who was afflicted, then they would have a chance of a child having sickle cell anemia. And then genetic testing for sickle cell anemia, there are 2 types that can be performed prior to a baby being born with sickle cell anemia. So one is called amniocentesis, and that's where cells are taken from the amniotic fluid of the baby, and they test it to see if the baby will either have sickle cell anemia, the trait, or be normal. And then there's another one called pre-genetic implantation, which works with IVF technology. And this is just to test embryos before they even begin developing to see if they have the mutated gene or not. Genetic testing like that is typically done prior to the baby being born, but however, it's common practice now for all babies, regardless of the parent's genetic background, to be tested within 24 to 48 hours for sickle cell anemia. They're both important, genetic testing prior to being born and after, because it allows for early treatment plans and management of the symptoms of sickle cell anemia. The two genetic tests previously mentioned are available through most healthcare clinics, like your gynecologist, things like that, but they are very expensive and pricey, which is probably why most people forego to do that. And those are my references.